Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. Many factors affect our health: what we choose to eat, whether we choose to exercise, and how much sleep we get. Those are largely within our control. There are other factors that impact our health as well. Here to discuss those with us today is Dr. Albert Tzeel, Regional Vice President for Health Services for Humana in Central and North Florida. Welcome, Dr. Tzeel.
Thank you, Patricia. Thank you for having me.
Dr. Tzeel, social determinants of health have been described as the conditions in which people are born, grow, live, and age. Will you tell us more specifically what would be considered social determinants of health?
Sure. No, the way I see it, and I think the way that they've been defined, is that it's almost, there's a number of different ways to look at it. It's almost like looking at the environmental factors that, as you said, that may be outside of one's control to some extent. Examples would be certain educational factors, because how educated someone is certainly impacts their health literacy and what they're going to do with respect to health. The areas in which people live, socioeconomic areas, transportation can certainly be a factor there. Food, of course, and access to food is an issue. And of course, we call them social determinants of health because we as humans are social creatures, but the impact of being connected to other individuals or being lonely, I mean, that plays a huge part in the health of individuals, both in a short and in the long term.
How are older adults especially impacted by social determinants of health, and is there a cumulative effect?
Older adults are impacted tremendously by social determinants of health because they can only control so much of them. I mean, I'll give some examples relating to what I was talking about a minute ago. For example, we know that food insecurity can be a major issue, especially for older adults. Those who may be living on fixed incomes have to make decisions. Do I buy medicine or do I buy food? And that can play a huge role in what happens to them, especially for those that may have chronic conditions that need to be addressed. The other aspect that we've seen, especially most recently, and especially even now, has to do with social isolation and ultimately in loneliness and being connected. And there's a couple different parts of social isolation. There's the quantity of relationships in terms of how many people an individual knows or is in touch with. There's also the quality of the relationship that's there. I'm reminded of an article that was in the New York Times. I want to say it was almost about 4 years ago, beginning of September of 2016, in which they actually said that loneliness is not only the next big epidemic per se at that point, but they actually said that loneliness caused more physical ailments than obesity. It's a significant problem. And if you think about it, what else does loneliness do for older adults? Well, if you don't have people to talk to or connect with, it impacts cognition, and certainly we run higher risks of developing ultimately Alzheimer's or other forms of dementia. I mean, I think about it almost in terms of the brain is a muscle. You have to exercise the brain the same way that you exercise other muscles. And loneliness has also been shown to impact other aspects of health, immune function, so that's really the biggest one. I think that impacts older adults, and one that we need to be most cognizant of.
Well, COVID-19 has affected everything this year. What effect has it had on older adults and the impact of social determinants of health?
Yeah, you're right, and it's a major understatement. This has been a year unlike any other. In terms of the impact that COVID-19 has had, I think it's really, unfortunately, promoted a significant increase in isolation of older adults. I mean, a lot of them, certainly from family members. I mean, we hear the stories, and I mean the heart-wrenching stories of people who have been, excuse me, people who have been ill in the hospital and haven't been able to see loved ones, of course, and had to talk to them over, you know, iPads or nurses holding cell phones. But even for other individuals, whether they're living independently or whether they're in some sort of other facility, they haven't been able to see their relatives or see their loved ones or connect with them. And there's something to be said for human touch or an embrace, or kind of more that direct contact that one has with another person. And so that's been one aspect. The other part is that it's kind of, and I hate to use this term, but it's almost in some respects, you know, almost like an out of sight, out of mind, that because we don't see other individuals, you know, you don't necessarily think about them. You may think about them because perhaps you went to a senior center where you'd have your silver sneakers class, and you become a kind of big social group. I mean, part of that is the exercise, but part of that is also the bonding experience that one has with the rest of that group. And people, you know, care for one another, and they know when John or Mary aren't at that particular session. They know about that, and then at that point, you know, someone goes and checks up on them. But when you don't have that session actually taking place, it's a little harder to think about that individual. And so I think that's made a major impact on especially on older adults. And that's led to, unfortunately, certain behavioral health conditions. It's led to more anxiety. It's led to more depression in folks. And then there's the kind of that third, and I'm not trying to minimize it, but almost in some respects a minor aspect. It's been hard for older adults then to get out and get food and get medicine and get access to other healthcare services they may potentially need. Fortunately, many physician offices and other groups have been able to do, you know, delivery to the door, which I think has been wonderful and has been very, very helpful. But it's still, even if you deliver it to the door, you're not seeing that individual coming to the door, and there's still not that connectedness that's there. And I think that's really caused, unfortunately, a significant, it's been a significant detriment to older adults.
Connection has to be a little more intentional these days. You don't have that just happening to run into somebody. It has to be a little more intentional to reach out to someone. And that has been challenging for a lot of people because of, just as you said, sometimes it's that out of sight, out of mind. And so reaching out to people is so important. And sometimes that person who is alone needs to be the one who reaches out to someone as well.
Oh, that's very true. It's really not a one-way street, and it's okay for someone to reach out to someone else and say, hey, I'm, you know, kind of raise their hand and say, I haven't heard from you in a while. I just want to make sure you're okay, you know, as much as they want to be checked on for themselves.
Absolutely. And so that leads me to another question. So these factors are bigger than any one person. But what are things that an individual or an organization can do to improve or lessen the impact or counteract the impact of social determinants of health?
Well, I'll start off by kind of following up exactly what and reiterating what you just said, Patricia, is that I think, excuse me, it's okay for the individual to reach out himself or herself and say, you know, I'm going to check up on you, because that you know, I get something out of the fact that the two of us are connecting. So I think that's certainly very important. But there are other places and other sites that folks can reach out to. I mean, one example that is very prominent and comes to mind for me as an organization working for Humana, which is an organization that certainly is very involved in our community and involved with our senior population, is a site that we helped put together called farfromalone.com. It's all just one word. It's a site that reminds people and provides resources to people to tell them that they're not alone and they're not by themselves, and there are other organizations and groups that can help them and can interact with them to to show them that we're all here and we're all still in this, you know, as the saying goes, it's become almost somewhat cliche, but we're all still in here in this together, even though we may be apart. And we're getting closer, and certainly here in Florida, we're getting, you know, the ability to open up a little bit more, but that I think many individuals, and appropriately so, are still a little bit wary of that. But that site certainly can provide some resources, and it also lists, you know, several other organizations that make outreach. I mean, your group, Senior Connection Center, is a wonderful organization for doing that and helping connect individuals. And so I think that, you know, there are groups out there. I think folks just have to know the resources of what's available and where to go to find those resources, and can kind of you know, help do that themselves in that regard. But the most important thing I'd also say is that we each have to remember both to be very you know, mindful and conscious of the fact that ultimately it's incumbent upon us to reach out and try to connect with other individuals. It's you know, it may seem like we're not making a big difference, but, you know, if we're still making a difference to that one individual, then we're making a difference.
And we'll have the website you mentioned, as well as some other resources, on an end card at the end of the video for people to access.
That's great. Thank you for doing that.
Dr. Tzeel, any final thoughts for us?
Yeah, the only thing I'll add is that, you know, it's interesting that we know that our physical health is ultimately impacted by, you know, our genetics, but it's impacted even more so by our environment, and the social determinants of health are certainly a major aspect of that. And there are things that we can do to mitigate the impacts, the potentially negative impacts of some of those, especially when it comes to loneliness and social isolation, and what we can all do together to address that, I think, you know, makes even a bigger impact than what any one of us can do individually.
Dr. Tzeel, thank you for joining us today. I'm Patricia Henderson, and this is your Weekly Connection.
Thank you.